What's inside?
News Talk 870 WHCU. It's the Morning News Watch, and it's my pleasure to welcome Amy Basciani, owner of Senior Helpers of Pulaski in beautiful Oswego County, to our program. Amy, good morning. And first, before we get into Class Act, tell me a little bit about what Senior Helpers does.
Well, Senior Helpers, we're in-home companion care company, and what we do is we have companion aides. A lot of times we like to call them personal assistants because they come into the house and they may help an elderly person, and we're not always the elderly. It deals with their activities of daily living, the normal things that we do to every day, like your self-care, your feeding, bathing, homemaking, your work and leisure. When these things start to, when people start not being able to do this type of stuff, we can come in and we can help them so that their life can be back to normal and they can continue to do the things that they enjoyed to do previously before something came in the way of that.
Now,
so we, go ahead.
I was going to say, so mainly it can be seniors at times, but a lot of times it might be somebody who had a serious accident or some other disability, right?
Yes, yep. Just anything that, they may need help with. Sometimes it is just companion care, though. Somebody may just be at home by themselves, and their children, live in another state and cannot take care of them at the moment, and we have a caregiver that can come in and make sure that they're eating, taking their meds, different things that the children may want to do but can't do at the moment. It can be anywhere from an hour to a couple hours a day to 24-hour live-in care. So it ranges. It's a very different thing depending on the client, what their needs are and everything of what we can provide for them.
And in many cases, this is long-term care because it may be a permanent disability, or again, it may be a senior situation with aging. So that brings us to the Class Act, which is something very few people heard about with the Health Care Reform Act. Tell me a little more about Class Act.
Well, it's actually what it is. It's in the health care reform, like you were saying, and it allows employees. You have to be working to have a small amount of their paycheck taken out in return for $75 a day of benefits that can be used for care or living assistance once this person cannot take care of themselves anymore. It's going to come into effect about January 2011. There's still a lot of stuff that has to be ironed out, but it's an amazing thing because as of right now, when I go into a home, I know there's a lot of people that want to stay in their home, and they cannot afford to do this at the time because with Senior Helpers, and I know a lot of the home care companies, you need to either have long-term care insurance or they're going to be paying out of their pocket.
And that's just cost prohibitive in a lot of ways, right?
Yeah, and it does. It makes an incredible sense because just to stay in the home is a lot less expensive than going to like an adult day center or the assisted living or the nursing home. But still, it does cost a little bit. And with this Class Act, it's going to be great because these people that I see that just want to stay in their home, and it's more pleasurable. They don't want to go away and leave everything that they've worked so hard for, and they can do that with this. So I think it's gonna be a great thing.
Yeah, we're talking with Amy Basciani, owners of Senior Helpers of Pulaski. It seems to me it will also increase the number of jobs for long-term health care because, we're talking to you in Pulaski. We're in Ithaca here. You might have Senior Helpers locations obviously grow in many other cities.
Yes, yeah. Because it is a big thing with all the baby boomers. This is going to be a huge growing thing. And like I said, everybody's worked so hard for their house and their home, and they want to continue, living the way that they've always lived.
Right.
And that's where, the home care agencies, as like Senior Helpers, we can help you do that and stay in the home.
And this is this stuff that's not covered by Medicare or Medicaid. It's important to note that, when you talk about dressing and eating, bathing, stuff like that.
Yeah, it's private pay, and the long-term care insurance is something that can help out with the private pay.
And much like Social Security, you pay into it for a few years, and you'll get vested after a couple of years, and then it will cover you for as long as you're alive, right?
Yep, it's a 5-year vesting period, and then you have to actively be working for 3 of those years before you can receive the benefits. It's just like that. Do you want me to go through some of the things that they,
Yeah, we'll throw it because again, this is whole. I consider myself pretty up on things, and this was the first time I heard about it, and I know personally I'm 41. I will definitely put in for this because who knows what later in life has in store for any of us, really.
Yeah, and when you don't know, sometimes when I do have actually a couple clients that do have the long-term care insurance, and there's so many times when I've said that there needs to be somebody out there to educate people about how important it is to save up for things like this because, it'll just hit you one day.
Right.
And all of a sudden you just have to figure out, it's kind of like counseling when you go into a home because they're just at their wits' end, and a lot of people don't know what to do or where the money's going to come from. That's why I just think that this is going to be great because they can save. You're not going to be taking a lot out of your paycheck. They don't really know the premiums yet.
Right.
And the more people that want to participate in it, the rates will go down and everything. But they're thinking it's going to be roughly like $60 to $120 a month, depending on, how many people participate. But then when you do get the benefits, that's $75 a day.
Right.
And most people do not need more than 3 hours a day,
right,
especially at first, just to make sure everything's going good. Sometimes it can just be, picking up around the house, making lunch, making sure that they have taken all their medicines or different things like that. Maybe going to the grocery store if their license has been taken away from them.
Right.
And that $75 a day will definitely cover, the in-home.
Right.
In-home care.
That premium sounds like a lot right now, but I think, as you said, the key is going to be how many people get involved with it, how many people take that insurance, and obviously some, like our company, provides long-term insurance, but it's only at 60% of salary. So, and that is primarily for medical coverage, not for non-medical issues. So.
Yeah, and that's that's a big thing because I know this is a little bit different because I know this will cover no matter what we get into, trying to give you the right words.
Yeah, no, it's going to be a key really to the future. And again, you mentioned the baby boomers retiring. We have a huge amount of seniors that are coming our way in the next 30 years.
And I think they're a lot more educated. With the Class Act, it doesn't exclude any pre-existing conditions. Like when you were talking about the private insurance or the long-term care insurance.
Yeah.
There is some things that if you have pre-existing conditions, like with all the different insurances, there can be some things that you will not be able to receive because of that.
Right.
The only thing with the Class Act is you do have to have a job, which is good,
Right.
But sometimes that can be hard for someone that may be on unemployment.
Mm-hmm.
Yeah.
All right. Well, we'll follow it closely. A lot more on this, I'm sure, as we get toward the new year, because that's when it's going to take effect, January 1st of 2011. Yep. Amy Basciani is owner of Senior Helpers of Pulaski. Amy, thanks for coming on and talking with us about this morning.
Thank you very much.